Today is World Tuberculosis Day, and a South African expert believes it is time for the country to do more to end the disease. Dr. Yogan Pillay is an extraordinary professor in the Department of Global Health at Stellenbosch University. He says despite TB being an ancient disease, there's been inadequate investment in vaccine technology compared to COVID-19, which was first identified in December of 2019. Dr. Pillay joins us now for further on this. Thank you very much for availing yourself this afternoon, Dr. Pillay. I think before we get into your thought piece article, perhaps let's talk about the South African landscape where TB is concerned. Just how far have we come and where are we to date?
Thanks very much, Dudu, and good afternoon to your viewers. South Africa has had a TB challenge, historically, and it started really with TB on the mines, especially the gold mines. And because of the silica dust, it affected people's lungs, and added to that, of course, significant levels of poverty, poor nutrition, and as you know, TB is bacillus airborne. When you cough, speak, spit, the bacillus and the bacilli can fly around and infect others. In fact, one person who has untreated TB can infect 15 others in a year. So it spreads rather rapidly. And what we see is that South Africa has a caseload of new TB infections of about 400,000 people each year contract TB. The challenge is that we are only treating around 300,000 of them. And we have about 100,000, 150,000 people each year who contract TB who are either not diagnosed or not on treatment and not cured of TB. And as you know, Dudu, TB is a curable disease, right? 6 months of treatment and you're cured of TB. So, we've got the tools to deal with it. We don't have a good vaccine. That's the problem. The vaccine we use currently is 101 years old. Now, compare that to COVID. We have so many vaccines for COVID, yet COVID was, the COVID-19 virus was only discovered at 2019, the end of 2019, beginning of 2020. So you can see that, we've not invested as much on TB as we had with COVID.
Dr. Pillay, according to some statistics, tuberculosis is the 9th leading cause of death worldwide. So according to your assessment, why is it that we are not progressing as much as we should? You mentioned the vaccine technology that is quite dated.
So in South Africa, for example, Dudu, we have about 80,000 people dying from TB annually. And one of the reasons that it's still so high is that, as you know, we have a very significant burden of HIV in the country. And people who have HIV, especially those that are not treated or not virally suppressed, have a good chance of contracting TB. So about 60% of those with HIV annually contract TB. So, these are two diseases that work off each other. So that's one of our other challenges. Besides our historical challenges, our other challenge is that we have large numbers of people who are immunocompromised, like people with HIV, who very easily contract TB. Now, we did make some progress over the last 10 years, and we saw that the numbers of people with TB were coming down. The numbers of people being treated and being successfully treated were going up. But of course, COVID, in the last 2 years has really taken us back, has set us back, both in terms of the number of people coming forward to get diagnosed and the number of people who are getting onto treatment. So we've got to recover from the impact of COVID, and we've got to do better. That means that people have to be aware of the TB symptoms. And that's why the Deputy President is relaunching TB Health Check. It's very easy to check your symptoms for TB, whether it's persistent cough for 2 weeks, chest pains, night sweats, losing weight. We have set up a TB Health Check. So if you dial *134 *832 *5# for free, you get on your cell phone, the symptoms, and you can check your symptoms, and if you check any positive symptom, you get referred on. You can also use WhatsApp if you just dial in the number 0600 123 456 and type in TB. Again, you will be taken through a list of prompts to check your TB symptoms. So it's very easy for anybody with a cell phone, any cell phone, to check TB symptoms and then get referred on if you check any of the symptoms as positive. So, we're making it very easy. It's almost like TB symptom check in your hand with your cell phone to check your symptoms and then go and get a diagnosis. And the diagnosis is very easy. You just cough up some sputum. It goes to the lab. It comes back. If it's positive, you can start treatment immediately. And over 6 months, you can get cured from TB.
Dr. Yogan Pillay, Extraordinary Professor at the Department of Global Health at Stellenbosch University. Thank you very much for availing yourself this afternoon.